Good morning, this is Ian Wright, the osteopath, and I just wanted to do a little podcast, very brief one, on what is paediatric osteopathy, because people ask it quite a lot. And there's a million ways of explaining it, so I'll just go into it very quickly. First of all, we have to ask, what is osteopathy? And how does osteopathy discern from any other modes of treatment like physiotherapy, chiropractic, etc.? First of all, osteopathy is like a hands-on treatment. That's what defines osteopathy. You're using your hands to make an effect on someone's body, which involves manipulation. Now, manipulation can be strong manipulation, high-velocity techniques which create a crack, or more gentle techniques which work with the soft tissues, the muscles, the ligaments, the fascia. Quite a lot of work with the fascia. And then to more gentle techniques which work with the fluids and the cranial bones, the cranial work, and even the biodynamic work, which works more on the kind of fluid dynamic in the body. So osteopaths have a wide variety of techniques, but it's all tied together with a philosophy, which is kind of a holistic philosophy, which talks about the body actually being a completely interrelated structure, a whole structure, and one part of the body can affect the other. Now, very simply, if, for example, you have an elbow problem, we need to look at the function of the shoulder and the back and the whole unit. So as a biomechanical unit, we have to look at it. And so as one, which is very clear and obvious when you're looking at, say, sports injuries. So someone who comes in with a complex sports injury that's affecting, say, their foot or their ankle, we have to look at the alignment of the pelvis and the way the knees function and the whole structural spinal alignment. So we have to look at the whole, but we can use that in terms of organ structures or a variety of things. So if a child is coming in in distress, or a baby's in distress, we have to source what's going on. So we're kind of like investigators trying to work out what is the cause of the problem and trying to change that by using hands-on treatment. And that can work through a huge amount of different conditions. So pediatric osteopathy is not necessarily something that you learn to a very great degree at an undergraduate course. A normal osteopathic course is either 4 or 5 years, full-time course, usually. The first is very, very similar to medicine, where you learn anatomy, physiology, pathology, etc., to a pretty high level, actually, these days. Then you start learning more hands-on techniques of actually how to work with problems on a physical level in the body. So pediatrics is something that people tend to learn afterwards. So I've been teaching pediatrics for about coming up 25 years, actually. And we've been running a postgraduate diploma in paediatrics in Ireland for the last 10 years. So we teach graduate osteopaths who've been practicing. Often they're very experienced osteopaths who come and they learn how to do, because it's very different in terms of, there's a lot of differences when you're treating children to when you're treating adults. You know, the whole structure is very different. The physiological processes in the body are different. And often the conditions that children are suffering from are different slightly from adults, although the philosophy can be very much similar. And also we tend to use more gentle, more fluid techniques when we're treating babies and children, because they don't need necessarily strong manipulation. They need more gentle techniques which can realign them gently or release blocks that are causing them trouble. So in babies, we tend to treat issues which come up from complexity in deliveries, hard labours, when the baby's head gets squashed, or they get squashed pre-birth, or they shock, and it can manifest in certain types of issues in terms of irritability, reflux, colic, etc. So we're looking at the cause, though. We're not really looking at the symptoms. We're looking at, actually, this baby has been squashed, and what we're doing as osteopaths, releasing the squash, or releasing areas that are blocked and have been affected by situations around the late pregnancy and the delivery, or if the child's been suffering or baby has been suffering from any illnesses, operations, etc., etc., they can have effects on the body and create blocks. And our job is to simply unblock blocks. And so as you go up treating children, blocks can cause different problems as well. So, we're looking at drainage, and we're looking at function of the ribs and of the chest function, the diaphragm function, and drainage of the throat when we're looking at ENT, chest issues, infections, for example, bronchiolitis or pneumonia can cause a weakness and scarring in the lungs and block that area up, and we're looking to really open these areas up. So our job really simply is to unblock blocks. And that can have an effect on a wide variety of issues and conditions with children. But, we look at very specific things like children who are undergoing orthodontic work and allowing the cranial mechanics to cope with that, which is a very important part of it as well. So there's a huge variety of actually, when we're in practice treating babies and children, every child is completely different, and we treat a huge amount of very complex conditions. In the Daisy Clinic, we're treating children with quite complex special needs, and it's difficult to unravel what actually can be done and what that can help each child, because each child has its own specific needs. And what we're trying to do in all cases, especially with special needs and specific learning issues, for example, is to unlock their potential and free up things as much as possible and unlock their potential. So, and actually that's really translated into when we're treating adults. We're unblocking blocks. We're releasing things that aren't functioning as freely as they want to be. If that's, a strain in a hamstring, or if that's a back problem, a sacroiliac problem, or that's someone who's getting constant headaches. It doesn't matter really. What we're doing is we're trying to look at how this body is being compromised and to free it up. That's really what we do. It's very simple really in philosophy. The trick is how to find the issues and release them. And that's why we spend forever learning it and practicing it. That's why it's called practice, because we're forever practicing to get better at doing that. And anyways, that's a little brief introduction to paediatric osteopathy. I wish you well.